Sometimes pain can be visible and obvious. Let's start on that. It's like a broken arm or a sore back. Everyone sees it. But the most frustrating kind of pain is when it's hidden from the outside, dismissed by doctors or people in your life. It can make you feel like this, invisible, like you don't exist, don't matter. No one should feel this way. So today, a more comprehensive and updated at-home questionnaire to find out if your hidden pain is fibromyalgia.
It started with a lot of unexplained pain.
Headaches,
aching, burning, muscle spasms.
pain everywhere.
In my arms,
It felt like a severe flu.
I had friends that didn't understand.
Can't you run, mommy?
Nobody believes you.
People didn't understand what I was going through.
When people can't see your pain, they write it off.
I went for test after test after test and still no answers.
I thought it was in my head at first.
I saw 3 different doctors and none of them could figure out what it was.
Doctors wouldn't believe me. Some would think that I was only in it for the pain medication.
I felt invisible because nobody believed what was going on with me.
This condition really does make you feel invisible.
When they finally diagnosed it as fibromyalgia, it was a huge relief.
I felt like, wow, it's not all in my head.
Finally, one day, the doctor put the pieces together. And the first thing he said after looking at tests and coming back in the room said, "This is not in your head. This is a very real thing. And I'm sorry it took this long."
I want to thank all the wonderful women in our audience for sharing your stories. I know that's difficult. I can see how emotion has touched you already. You guys okay? It's tough to watch, isn't it, sometimes?
Yeah, it is.
Well, you're honored today. I'm honored to have you here, and we're going to pay tribute to you all by giving you some answers. So Jennifer Caudle is here. She's a physician who's been treating fibromyalgia patients for nearly 10 years. When she first started seeing patients with this condition, a lot of doctors, a lot of people like me, thought it was made up. But you see there's been big developments in pain management for these folks.
A lot of things have changed. We have a lot more information than we used to have. You know, we used to diagnose fibromyalgia by looking specifically at tender points, the areas of the body that are specifically tender. But now we know that fibromyalgia is more than just tender points. And it's really almost like a constellation of symptoms. And that's one of the biggest changes in the last so many years, is that we look at this whole constellation of symptoms to really come up with that diagnosis.
So I heard words exhaustion, pain.
Right.
These are things that exist in everyday life. How does that differ from fibromyalgia?
I'm glad that you asked that, because I think that's the question that a lot of people have, is they say, well, what makes someone have fibromyalgia versus not? So the criteria is very specific. And let me tell you, when I think about fibromyalgia as a condition, 2 things really come to mind. I think of pain, I think of exhaustion. So the diagnostic criteria really requires that a patient have chronic, widespread pain, kind of all over their body. They also have symptoms such as fatigue, waking up feeling unrefreshed. That means like you get 8 hours of sleep, but you wake up in the morning, you feel like you haven't slept a wink.
No better off, right?
Right. And also cognitive issues, feeling fuzzy or foggy in the brain and things like that. The symptoms must be there for at least 3 months and not be attributable to another condition. And that's what makes it different.
So the big question then is, how do I know I really have it? Can I get a blood test to tell me that? And unfortunately, there is no blood test.
No, there's not a blood test. And in fact, one of the things we think is underlying fibromyalgia is sort of abnormal pain processing. We think it's an issue of the brain and spinal cord. People with fibromyalgia almost have this heightened sense of pain that they experience because of the way their brain and spinal cord sort of processes pain. And that's one of the most sort of important points in terms of why it happens and sort of what we think the mechanics are.
So the pain might be the same as somebody else might have, but they sense it differently.
Yeah,
a little more loudly.
I think of it like this. So if you don't mind me pinching you,
Please.
so if I pinch you, okay, you might say, oh, well, that's annoying, Dr. Caudle.
That wasn't much of a pinch.
Okay, I'll pinch you hard.
Ow!
Oh, okay, there. You want me to do it again? No, okay. Okay, you're saying like, okay, that was uncomfortable, but perhaps a patient with fibromyalgia, if I did that same pinch, they might perceive that pain as being that much bigger, that much worse than someone like you or me who doesn't have fibromyalgia. And it's because of that abnormal pain processing. They perceive pain differently at a higher level.
Is that all resonating with you all? It's sort of what you're feeling? So here's the thing, because there's no blood test, no simple way of diagnosing the problem, what we're going to do is walk everyone through a way of diagnosing themselves. So Dr. Caudle, come join me if you don't mind.
Okay.
I'm going to grab Morgan. Morgan, you're going to join us if you don't mind. You'll speak for the group, all right?
All right.
So there's a new at-home fibromyalgia questionnaire. Everyone in the audience has one. It's also available on our website. It's easy to do. It's 2 questions. Only 2 questions you got to answer. The first is to calculate how widespread your pain is. So Dr. Caudill, please explain how you use this mannequin to teach us that.
Sure. Well, this is sort of our model. We think of fibromyalgia as having chronic, widespread pain. Widespread really means what it sounds like. Pain can happen anywhere in the body. We have both the front as well as the back. So you can see here, pain can be on the neck. It can be sort of in the back of the shoulders. It can be in the lower back here, the buttocks, etc. And again, even down to the legs. And what's really important to note here is really all of the areas that you've had pain in these regions for the last 3 months or so. Where have you had pain?
Right. So everyone in the audience and at home, if you can get this off the website, just quickly check the boxes that apply to your pain. You're going to need that later on. So Morgan, come on back here. Let's talk about your case. So we actually looked at your model here, and this is this is what the illustration looks like on the page. So if I look at this right now and I add up all the red boxes that you checked off, it's 14 pain boxes. Dr. Caudill, do I do that right?
You did. You absolutely. You just want to count up the areas that you've checked off on your boxes, add them up, and see what you come up with. And it can be both the front and the back of the body as well.
So remember that number 14. Everyone check off the boxes that apply to you and keep track of that number. The next thing, the second question, only two again, is to tally your overlapping symptoms. If you don't mind, walk us through these.
Sure. So we talked about fibro being not just pain, but also other symptoms that you may have as well. And I think you probably experienced these, right? But remember, fibro patients can often have other symptoms: bladder issues, headache, depression, anxiety, heartburn. There's many others. This is just a few.
So you checked off all these boxes. There were 6 total. So we got everyone okay with here. So you can add up the number of pain points you have from the prior question and the number of these overlapping symptoms, and you're going to put them together, right?
Yes.
And when you have that number, what does that mean?
So what I would say is, well, actually, we've got your number, right? So we've got 14 plus 6. Do we have? So we have a total of 20.
Yeah.
What I would say for people who are watching at home, you're doing this questionnaire, if you have at least 7 or more symptoms, and at least 3 of those are in the pain category, you need to see your doctor. Now, let me be very clear. This is not the specific diagnosis for fibromyalgia. This will not diagnose your fibromyalgia. But what this is a great tool to track your symptoms. Get an idea of what's going on with your body to be able to literally take this, bring it into your doctor, and talk more about it.
So once you figured out that you may have fibromyalgia and you're no longer invisible, which is a big part of what we're talking about today, what do you do with that? What are the current treatments that might be helpful? Give some hope to patients suffering from fibromyalgia.
Sure. Well, there's a lot of great treatments. And that's the thing. When you go to your doctor, they're going to want to rule out other conditions, want to probably do some tests and things like that. But there are great treatments. There's a number of FDA-approved medications that are on the market that treat fibromyalgia well. But we think one of the best things is sort of lifestyle changes. I always tell my patients, let's, number 1, get rid of the stress. Number 2, let's get you moving. We want to manage the anxiety, depression, and stress that comes with it, but we also want to do sort of gentle exercises. And I don't know how you felt about it, but a lot of my fibro patients, they say, well, I'm already in pain, Dr. Caudill. Why do I want to move anymore? But the truth of the matter is we know graded exercises, yoga, tai chi, kind of pool exercises, physical therapy can actually be very helpful. So using that big pot of stuff, we want to pull our therapies out. So,
Is this helpful for you?
Yes, a lot of that.
All right, God bless you. Thanks for being here. Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.